I'm Barbara Jors, President and Chief Executive Officer at Gillette Children's Specialty Healthcare. Gillette is an independent, freestanding, not-for-profit pediatric healthcare system in Minnesota, United States of America. Gillette's main campus is in St. Paul, Minnesota's capital. We operate 10 locations throughout Minnesota, spanning both urban and rural locations. Our hospital has 60 acute care beds, standalone and multi-specialty clinics, advanced imaging, surgical and procedural suites, and other services to support hospital and clinic-based care and support services. Our hospital is home to a world-renowned gait and motion analysis lab, the first center in the United States to be accredited by the Commission for Motion Laboratory Accreditation. Co-located in St. Paul also includes our outpatient facilities, including clinics, therapies, orthotics, prosthetics, and seating services. At our main campus and throughout Gillette, we offer also robust virtual care programming. At Gillette, we lead through innovation. Research is a critical driver of how we advance diagnosis and treatment interventions for pediatric, musculoskeletal, and neurological conditions. Our providers and research staff are passionate about improving the lives of our patients and relentlessly pursue questions to discover the newest and best evidence-based treatments. Gillette's history and expertise in caring for medically complex children makes us uniquely positioned to conduct research that will touch the lives of all of our patients, especially those who have rare diseases or conditions. The contributions of our providers and staff lead to increased knowledge, discovery, and treatment options within the fields of our expertise. A unique type of hospital and clinic system, our mindset of discovery and innovation has generated a unique data set from a special research population, one that most in the healthcare industry do not have or do not consider. Our proficiency makes us a resource and partner for healthcare organizations and patient families across the United States and around the world.
Hi, I'm Mike Nierman, the Chief Medical Officer of Gillette Children's Specialty Healthcare. Like all healthcare systems, Gillette quickly adapted to the realities of COVID-19 to ensure that our patients continued to receive the care they needed. The acuity of our patients is one of the highest of all independent children's hospitals in the United States. Given the unique pediatric population we serve, our most important challenge was balancing the need to protect our medically fragile patients while also continuing to ensure care for a patient population that is so often denied access to essential services. This meant adjusting workflows across all departments, including non-clinical teams. For example, Gillette's providers and research staff visited patients at their home to complete a follow-up visit for a clinical trial. This agility allowed us to safely continue important research work. Another example was a regimented patient review by physicians and advanced practice providers, focusing on 3-month care plan priorities for active patients, with nurses conducting wellness check telephone calls.
Gillette coordinated with state public health officials. Initially, the vaccine would be only available in limited quantities and distributed in tiers. We established a vaccination site for Gillette patients and their home caregivers. Vaccinating home caregivers was especially important as many did not initially qualify, nor could they be vaccinated by other providers. However, Gillette patients are particularly susceptible to COVID-19 complications, and not all of them can be vaccinated. As a result, Gillette worked with the state to ensure that patients' home caregivers were eligible for vaccination, as this enhanced protection for our vulnerable patients. In addition to safeguarding the care and well-being of our patients, we led state and national efforts to advocate for children who are particularly vulnerable to infectious diseases because of their medical complexity. U.S. hospitals experienced a negative fiscal impact due to the pandemic. To alleviate this, the government appropriated funding to hospitals so that they could continue to provide critical services. The initial round of government funding to provide relief to hospitals excluded freestanding children's hospitals like Gillette. Understanding how important this funding would be for children's hospitals and their patients, Gillette successfully led efforts to ensure that children's hospitals would receive needed funding. As the state government mandated the discontinuation of elective procedures, Gillette successfully advocated for the continuation of medical procedures for complex pediatric patients. For these patients, medical services are not elective and often cannot be delayed. We also work closely with people with disabilities and organizations advocating for people with disabilities to assure our patients' needs were considered as part of the state's response to the pandemic. We joined the Minnesota Department of Health's Disability Advisory Group on COVID-19 to ensure that our patients' unique needs were met under the state's response to COVID-19. This included assisting the department in drafting guidance for Minnesota hospitals to ensure that pediatric patients and patients with disabilities maintained access to care. Additionally, supporting staff well-being was of the utmost importance. Among several employee support initiatives, Gillette established an employee assistance fund, which provided financial support to our staff in need. In creative ways, the teams at Gillette assured the continuation of clinical care, research protocols, and advocacy. While we continue to draw lessons, we have come away with a few key learnings. First, we must be agile to continue to provide essential services to our patients after regulations ban all elective services. To address this challenge, we scaled up our virtual clinical care service and now also offer virtual rehab therapy. Patients have improved access to rehabilitation services, particularly patients in rural areas. Our therapists better understand the environmental and logistical factors of their patients' care plans because now they are able to see into the home environment. Second, the pandemic underlined the importance of addressing our patients' well-being. Throughout 2020, we proactively completed wellness checks. The goal was to identify and address modifiable risk factors and urgent health needs. We connected patients with the appropriate social work, scheduling, or medical staff to address the recognized needs. The wellness checks also addressed access to resources such as medications, medical supplies, and home care services, as well as the social determinants of health, including food, housing, and safety. Third, though Gillette has always been a strong advocate, the pandemic required us to be stronger and bolder in our efforts. We have been leaders, working with state and national partners to relentlessly pursue solutions that we know best support our patients. Finally, we have maintained an intense focus on our staff's well-being. As frontline workers, our staff were and continue to be at considerable risk of burnout, anxiety, and stress. Our staff is our most valuable resource, and we continue to focus on their well-being. All that we achieved is only possible because of Gillette's staff. I continue to thank the entire team for their dedication and sacrifice throughout the enduring pandemic. It is their steadfast commitment to our patients and our families that drives Gillette's ability to continue innovating into the future, even during the most challenging of times. I invite you to reach out to learn more about Gillette Children's Specialty Healthcare.